Antisocial personality disorder represents one of the most challenging and socially significant mental health conditions, affecting approximately 1 to 4% of the general population and occurring more frequently in males than females. This complex disorder is characterized by a pervasive pattern of disregard for and violation of the rights of others that begins in childhood or early adolescence and continues into adulthood. Unlike other personality disorders that primarily affect the individual's internal experience, antisocial personality disorder has profound implications for society, families, and communities due to its association with criminal behavior, interpersonal exploitation, and disregard for social norms and legal boundaries. The diagnostic criteria for antisocial personality disorder require evidence of conduct disorder with onset before age 15, along with a pervasive pattern of disregard for and violation of the rights of others occurring since age 15. This pattern includes failure to conform to social norms with respect to lawful behaviors, as indicated by repeatedly performing acts that are grounds for arrest, deceitfulness as indicated by repeated lying, use of aliases, or conning others for personal profit or pleasure, impulsivity or failure to plan ahead, irritability and aggressiveness as indicated by repeated physical fights or assaults, reckless disregard for safety of self or others, consistent irresponsibility as indicated by repeated failure to sustain consistent work behavior or honor financial obligations, and lack of remorse as indicated by being indifferent to or rationalizing having hurt, mistreated, or stolen from another person. The development of antisocial personality disorder involves a complex interplay of genetic, neurobiological, and environmental factors that begin manifesting in early childhood. Research indicates strong genetic components, with twin and adoption studies showing significant heritability rates for antisocial behaviors. Children who later develop antisocial personality disorder often display early warning signs including persistent aggression, cruelty to animals, fire-setting, persistent lying, theft, and serious violations of rules at home and school. These behaviors, collectively known as conduct disorder, represent the childhood precursor to adult antisocial personality disorder and indicate disruptions in normal moral and social development. Environmental factors play crucial roles in the development of antisocial personality disorder. Childhood abuse, neglect, and exposure to violence significantly increase the risk of developing antisocial traits. Growing up in chaotic, inconsistent, or harsh family environments where violence is normalized and empathy is not modeled can contribute to the development of callous and exploitative behaviors. Socioeconomic factors, including poverty, neighborhood violence, and limited educational opportunities, can also influence the development of antisocial behaviors, though the disorder occurs across all socioeconomic levels. Neurobiological research has revealed important insights into the brain differences associated with antisocial personality disorder. Studies using neuroimaging techniques have identified structural and functional abnormalities in brain regions associated with empathy, moral reasoning, and impulse control. The prefrontal cortex, which is responsible for executive functioning and moral decision-making, often shows reduced activity in individuals with antisocial personality disorder. The amygdala, which processes emotions and fear responses, may also function differently, potentially contributing to the reduced fear response and lack of empathy characteristic of the disorder. Living with antisocial personality disorder creates significant challenges, not only for the individuals themselves, but also for everyone in their orbit. People with this condition often engage in manipulative and exploitative behaviors that damage relationships and harm others. Their inability to form genuine emotional connections and their tendency to view others as objects to be used for personal gain can lead to a trail of broken relationships, financial exploitation, and emotional harm. The lack of empathy and remorse that characterizes the disorder means that individuals may not recognize or care about the pain they cause others. The impact of antisocial personality disorder on families can be devastating. Family members often experience cycles of hope and disappointment as they attempt to maintain relationships with someone who repeatedly lies, steals, manipulates, or engages in other harmful behaviors. Parents may struggle with guilt, wondering if they contributed to their child's condition, while siblings may feel neglected or endangered by the antisocial individual's behavior. Spouses and romantic partners frequently experience emotional, financial, and sometimes physical abuse, often feeling trapped in relationships characterized by deceit and exploitation. In professional settings, individuals with antisocial personality disorder may initially appear charming and competent, but their true nature often emerges through patterns of dishonesty, rule-breaking, and exploitation of colleagues or customers. They may engage in workplace theft, fraud, or other illegal activities, and their inability to accept responsibility for their actions can create ongoing conflicts with supervisors and coworkers. Their superficial charm and manipulative abilities may allow them to succeed in certain professions, particularly those that reward aggressive or competitive behaviors, but their lack of genuine empathy and tendency toward unethical behavior often leads to eventual exposure and consequences. The relationship between antisocial personality disorder and criminal behavior is well established, with studies showing that a significant percentage of incarcerated individuals meet criteria for the disorder. However, it is important to note that not all individuals with antisocial personality disorder engage in criminal behavior, and not all criminals have antisocial personality disorder. The disorder exists on a spectrum, with some individuals primarily engaging in interpersonal manipulation and emotional harm rather than overt criminal acts. Diagnosing antisocial personality disorder requires careful assessment by qualified mental health professionals, as the condition can be confused with other disorders or masked by the individual's manipulative presentation. The diagnostic process involves comprehensive clinical interviews, review of historical records including criminal history and childhood behavior patterns, and assessment of current functioning across multiple domains. Clinicians must differentiate between antisocial personality disorder and other conditions such as narcissistic personality disorder, bipolar disorder during manic episodes, or substance use disorders that may produce similar behaviors. Treatment of antisocial personality disorder presents unique challenges, as individuals with this condition rarely seek treatment voluntarily and often lack motivation to change their behavior. When treatment is pursued, it is typically mandated by the legal system or occurs in response to external pressures rather than internal motivation for change. Traditional psychotherapy approaches may be less effective due to the individual's tendency to manipulate therapists and their lack of genuine empathy or remorse. Therapeutic interventions that show some promise include cognitive behavioral approaches that focus on practical consequences of behavior rather than emotional insight, structured programs that emphasize accountability and clear expectations, and group therapy settings where manipulation is more difficult to maintain. Treatment programs in correctional settings may incorporate elements of moral reasoning development and social skills training, though success rates remain relatively low compared to other mental health conditions. Family therapy and support for family members are crucial components of comprehensive treatment approaches. Family members need education about the nature of antisocial personality disorder, strategies for protecting themselves from manipulation and abuse, and support for their own emotional well-being. Setting clear boundaries and refusing to enable harmful behaviors are essential skills that family members must develop. The prognosis for antisocial personality disorder varies significantly among individuals. Some research suggests that antisocial behaviors may decrease with age, particularly after age 40, though the underlying personality traits typically remain stable. Early intervention during childhood and adolescence, when conduct disorder behaviors first emerge, offers the best hope for preventing the full development of antisocial personality disorder in adulthood. Prevention efforts focus on identifying at-risk children and providing intensive interventions that address family dysfunction, teach social skills, and provide consistent consequences for harmful behaviors.